there. So for this capsule, we're going to talk about preparing for birth already. So you're getting closer to the delivery date, but not quite there. So we're going to talk about the partner. And because it's really important, you know, delivery are often focused on the women, but the partner plays a really, really big role. So what I recommend you do is that you make your birth plan together and you decide on what you expect at the hospital and what you'd like your partner to do also at the hospital, because he can play a really, really big role. And I just want to say, don't forget that sometimes, you know, of course, the women are the one delivering the babies, but the partner also feels sometimes helpless, or, you know, like it feels really bad for the person having so much pain. So they feel a whole lot of emotions as well. So make sure you talk about that before the moment when it arrives. It might not be a good timing for that. And so when we'll do the video at the hospital, you'll also see what is possible, the equipment that is there, so your partner can get accustomed. Braxton Hicks, you may have heard that name before. It's called also false contraction. That's the time during your pregnancy when you may start experiencing something happening in the abdomen and you feel like it's getting hard and it might hurt. And right away, our first reflex is to think, oh my goodness, I'm going to have the baby. So there are ways to know if it's the real thing or if it's false labor. Braxton Hicks are actually normal, and they start happening in the third trimester, sometimes at the end of the second trimester. And they come on as like pain, or you feel your abdomen getting really hard. How to make the difference is that they're not regular and they don't increase in intensity. So sometimes having a bath will make them disappear completely. Lying down as well sometimes really helps and the pain disappears. If you rest, if you have a bath, if you go for a walk and they disappear, well, you know it's not true labor. However, if they're regular, the increase in duration and in intensity, and you have loss of like fluids, or you start to bleed even slightly, you need to go to the hospital right away. Multiple birth. You know, some people are very happy to find out they're going to have more than one. Some people not so much. So I think it's, you know, it is what it is. Nature decides. So for those who were not ready or prepared to have twins or triplets, it's really important that you talk about it and get help and demystify. You know, for some people, it's just fear related to having to look after two babies at once. I'm going to talk about identical versus non-identical. Identical twins means that they come from the same egg and the same sperm cell, so it's one divided in two. Non-identical is two eggs, two ovules. So when they're non-identical, they can be like a boy and a girl. So, and they're definitely two different babies born on the same day. So that's the difference between the two. Having twins, of course, may increase the risk and the aches and pains during pregnancy. For that reason, you will have a much tighter follow-up. Some women have easy pregnancies, while others experience some problems, especially towards the end of the pregnancy, where the risk of having prematures is much higher. And also low birth weight. So those are the complications during pregnancy. You can still have a vaginal delivery. However, or sometimes if there's any risk for the mother's health and the babies, they might have a C-section that is planned, or even an emergency C-section. So just be mentally ready that you may have a different delivery. But for that reason, like I said, the doctor will make sure that you have a really tight follow-up, also decrease the activities towards the end of your pregnancy. You need to rest, you need to respect what the doctor is telling you to do, the recommendations. I just want to talk slightly about the intake, the food intake, because some people think when you're expecting twins, you have to eat so much more. Well, not necessarily true. Of course, you need to make sure that you have enough nutrients. So usually, if the woman experiences, difficulty with a diet or eat enough, the doctor will refer to a nutritionist. So when to consult? I just want to make sure that it's clear. When do you go to the hospital when you're pregnant? Because some people say, I'm going to go there for nothing, or it's better to go to the hospital for nothing than to stay home and there's something bad happening you're not aware of. So if you have any bleeding, vaginal bleeding, you need to go. If you're fainting, if you have severe headaches, blurry vision, you have pain, you also feel like you have trouble breathing, you need to go to the hospital. After the 26th week, if you don't feel your baby moving at least 6 times during the day, you need also to go to the hospital. You'll have a test to make sure the baby is okay and the movements are fine. Also, if you have contractions that increase in duration, in intensity, you need to go to the hospital. Another reason to go is if you lose amniotic fluid or you're not sure you lose fluid, you also need to go to the hospital. If you have an accident, severe hit in the stomach, you need to go make sure everything's okay, shortness of breath. Those are all good reasons to go and get checked out. We'll see you in the next capsule.